Rhythm method. The rhythm method is a type of birth control that involves tracking your menstrual cycle. This form is also known as the calendar method because it involves tracking your menstrual cycle on a calendar to predict ovulation. Method is a type of natural family planning or fertility awareness because you track your menstrual history to predict when you'll ovulate. This helps you determine when you're most likely to conceive. The word rhythm describes a cadence or a predictable table pace. The rhythm method of birth control describes your body's natural rhythm or the rhythm of the calendar. The rhythm method is effective 75% of the time, although this method is not effective as taking birth control pills or using IUD. The advantages. Benefits of this method would be that it's free, inexpensive, and doesn't require prescription. Using this method as a form of birth control doesn't pose any direct risk. There is no physical side effects of this method. The disadvantages. This method shouldn't be used if your cycle is fewer than 26 days or longer than 32 days. This method has no protection against STIs. This method can't exactly tell you for sure when you're fertile. These are some of the apps that could be used. Some information about this method is that it has a failure rate of 8 to 25%, but with perfect use, the failure rate is less than a 5%.
Chemical barrier birth control. Chemical barrier birth control is also known as spermicides. They come in a variety of options like foams, creams, gels, and suppositories, which are inserted close to the cervix using an applicator, which is shown here. They work by damaging or killing sperm so that they can't travel into the uterus and fallopian tubes for fertilization. They will have instructions to tell you when to put them in, but it's usually about 10 to 15 minutes in advance. You can get them without a prescription in most drugstores and supermarkets, and they can cost anywhere from 60 cents to $3. You should use them with another type of birth control because they aren't always as effective on their own, only preventing pregnancy 70% of the time. 28 out of 100 couples every year have an accidental pregnancy when using chemical barriers. They don't protect against STDs and should be used with a condom. They can also cause irritation, and people who use them are more likely to develop urinary tract infection. These are best for people who just want additional protection and are already planning to use another kind of birth control.
Alright, so mechanical barriers are contraceptives that physically block sperm from reaching the egg. They're used by both men and women, and some types include condoms, diaphragms, cervical caps, and contraceptive sponges. Going into male condoms first, they're thin and skin-like, and they're worn over the penis. To use them correctly, you have to first make sure it's in good condition. You place it on the tip, leaving some space, just so there's an area to collect semen. You roll it down all the way, and then after sex, you have to take it carefully before the penis gets soft, and then throw it away without spilling anything inside. Some tips include using lube to prevent breakage and not doubling up on condoms, because this can cause friction between the condoms and it can break. Realistically, there's an 87% effectiveness rate with condoms just because life happens and there's human error, but ideally it should be 98% effective with preventing pregnancy. Some pros are that condoms do reduce sexually transmitted diseases. They're really inexpensive, they're easy to use. Some cons are they may break, but this is easily avoidable, and lastly, you can't really use them if you have a latex allergy. Some types include latex, which are your regular ones and the most common, but there's also lubricated ones, spermicide-coated ones, and textured ones, and those are just for pleasure. Female condoms, they're pretty similar with the prep, like making sure it's in good condition, but you do have to put it inside your vagina, and to do that you have to get in a comfortable position and squeeze the sides of the ring and make sure it covers your cervix. So during sex, you do have to guide your partner's penis into the condom, and then after sex you do have to make sure to throw it away. while you're inserting, it is a good idea to use water-based lube just so you use it properly and make sure it goes all the way in. And you make sure not to use anything other than water-based lube just because it could mess with the material of the condom and obviously not work as effectively. But yeah, they also do reduce sexually transmitted diseases. They're also inexpensive and they can be used for anal. The cons are it might break as well. And again, with latex allergy, you cannot use it. But they are harder to find compared to male condoms, and they could be uncomfortable and hard to use. And ideally, there's a 95% effectiveness rate, but human error brings that down to 79%. Diaphragms are also another mechanical contraceptive, and these are just like silicone cups to prevent sperm going into the cervix. To use it, you've got to spread the lips of your vulva, first making sure like your hands are clean and the diaphragm is in good condition, and you have to make sure it goes all the way up into the vagina and it covers your cervix. But you do have to use it within 2 hours of like putting it in, just because you do have to use spermicide with it, and within that time, like that's when the spermicide is most active. Some pros are there's no interruption of sex and there's no hormones involved, which is great because you avoid all the side effects with hormonal issues, and that includes weight gain, mood swings, and changes in your period. Some cons are they can be hard to use. There's no protection against STDs, and they may irritate your vagina since you do use spermicide. And when your vagina is irritated, it does become more prone to being like diseased, I guess. So your chances of HIV and UTIs does go up. And they're also not a one-size-fits-all ordeal, just because everyone's cervix is different. And they can be expensive, almost up to $250. But there are different types of diaphragms. Generally, flat spring diaphragms are used for those with good vaginal muscles, and arching and hinge spring diaphragms are used for those with weaker vaginal muscles and a long cervix. And usually that's found in people who have given birth, so yeah. Statistics are that it's 94% effective if used perfectly with spermicide and within the time frame, but because of human error, it's normally around 83% effective. Cervical caps are really similar to diaphragms. They both cover the cervix and they're both silicone cups. They are shaped a little bit differently though. Caps are shaped like a sailor's hat and diaphragms are shaped like a dish. Cervical caps can also last up to 2 years, but you have to consider like a lot of things before using one. If you're uncomfortable with the idea of putting a cup in your vagina, then don't use it. If you've also given birth or had an abortion within the last 6 weeks, it's recommended not to use it, just because your cervix might be stretched and the cap will not like cover as much. And if you're allergic to silicone or spermicide, don't use it. And if your partner or you have HIV or AIDS, it's not recommended for use since there's no protection for that stuff. And if you've had toxic shock syndrome. And there's also a difference in effectiveness based on whether or not you've been pregnant. Usually before giving birth, there's an 86% effectiveness rate, and after birth, it's around 71%. And like I said, that's just because your cervix is stretched. It's also not hormonal, which is good. There's no interruption of sex, and it does last a while, so it's not like female condoms where you do have to throw it out. And as I mentioned earlier, there is no protection against STDs, and similar to the diaphragms, there is increased risk of UTIs and HIV if you don't keep it clean or don't take care of it.
A contraceptive sponge is a donut-shaped birth control device that has an indentation in the middle. They're about 91% effective before birth and 80% after. Coitus interruptus is also known as withdrawing. It's about 78% effective, but doesn't protect from STDs.